think the focus on value is going to be paramount, not only with the commercial health plans, the Anthems and Uniteds and whatnot, but also the federal government is really moving the industry toward value. And value, the way they tend to define it, is a combination of high quality, high satisfaction, and affordable cost. And that leads to greater value. And again, a lot of folks are talking about that, but the real action is, can you deliver it? And that's why MemorialCare has been so deliberate on expanding away from what we've done for 112 years, and that's acute care hospitals at a very high level, expanding out into the community, in community-based centers. In addition to our partnership with RadNet and Imaging, we also have ambulatory surgery centers, diagnostic diabetic centers, as well as home-based dialysis, which is a kind of a new area in the United States. Only about 10% of the public gets their dialysis at home at night when they sleep. In some other countries, it's 30 or 40%.
Wow.
And that's much more convenient, lower cost. It's really a better all-around outcome.
Okay.
And so we continue to expand in those areas.
Okay, and then in regards to what you were mentioning earlier about, it's sort of a gateway, imaging is a gateway to finding out things. How are you seeing things change?
Well, I think the diagnostic imaging industry is changing very rapidly. And I think not only technology advances, but I think that, there's going to be more treatment options using diagnostic imaging in our facilities. I can think of a couple right offhand, like prostate disease, where you're doing prostate ablation in an imaging facility using MRI and an ablation device with the urologists and the radiologists working together. I can see that in the future we're going to be delivering chemotherapy drugs on nuclear medicine with the nuclear medicine radioisotope by attaching the chemotherapy molecule onto the radioisotope and delivering the chemotherapy to the area of interest. I see ablation using MRI for uterine fibroids.
Wow.
So that's going to be rapidly changing. I think a few other things that are going to be changing in our industry is we're going to see, which is a hot topic, population health, screening more patients to diagnose patients earlier instead of later, so they not only get a better outcome, but you can treat those patients sooner, and finding their disease sooner is, of course, the key to that whole process. I think artificial intelligence in radiology is going to play an unbelievable role in our industry.
Okay.
And from the standpoint of consistent and early diagnosis, all the way to storing the data and the information to be able to look at that data and look at that information over a period of time, and forming consistency in diagnosis and more specific diagnosis to go with the treatment.
So how will MemorialCare adapt to that? I mean, obviously you've been around for a while and there's an awful lot of technology. I mean, you have the doctors that have to know how to do a lot of what he's talking about.
Well, we're fortunate in that we have 2,300 doctors that are part of the MemorialCare health system family, including our own medical group, MemorialCare Medical Group, and our own IPA, Grading Report Physicians.
Okay.
And we have partnerships with multiple universities, and so they're always getting that advanced education and keeping up with the latest in technology.
Okay.
MemorialCare prides itself on buying the latest technology that we believe can truly deliver better quality, because that's key. What Norm mentioned about some of the advances, to me, it's mind-boggling. I mean, for example, knee surgery, knee replacement, something that's not uncommon, hip replacement, not uncommon, used to be done it's been done for decades in hospitals, and the folks would stay 3, 4, 5 days.
Right.
Today, we can actually do them in an ambulatory surgery center. You're in the morning, you get up at 1, you walk at 4 p.m. that day, you're home at 6.
Wow.
And it's 1/3 the cost.
Wow.
That's the approach to value that we're focusing on.